Hey YouTube friends, do your knees hurt? Are you looking for help because you get sudden sharp pain in your knees when you move them a certain way? Or are you getting more of a dull achiness in your knees that comes on more as the day goes on or as you use your knees more? Or worse yet, are you getting stiffness and swelling in a knee when you wake up in the morning or if you've been sitting for a long time? I'm going to cover with you today the top 5 at-home treatments for when your knees hurt. Before we go into those 4 treatments, let me just clear up one thing. There's lots of reasons why knees hurt. There can be a cartilage problem, a meniscus problem, ligaments, muscles, tendons. There's lots of things inside a knee joint. And in order to get a knee all the way better, this video is just showing you how to get it a little better so that you're not having to take pain medications and injections, or maybe even skipping a day with the doctor. But if you're looking for the next steps, we've got tons of helpful videos specific to cartilage, ligament problems, muscle problems, and even nerve problems that can affect the knee. And you can find them by going into our channel and find our playlist that's all about knee videos. You can find specific topic videos there. So check out our channel and hit subscribe so you can be notified whenever we release new knee pain content. At-home treatment number 1, rest. Rest can be done all kinds of different ways, but I'm going to go through with you how I guide my patients on the proper way to rest so that you can go as fast as possible at getting some relief for a knee pain problem. When your knees hurt, you typically reflexively want to just get off your feet and rest your knees, and that's good. It'll bring down the inflammation, it'll keep it from getting more irritated because chances are what you've been doing has been irritating your knees. So it's a good thing overall to rest. The problem is when rest is taken too far. What we often see with clients whenever they come in with a knee problem is, of course, they tell us their knees hurt the more active they are, so they've taken a week or 2 or more off their legs. They haven't been doing much. They've avoided doing chores at home, exercising, spending time with family in some instances, going on trips or vacations. It's really disrupting their life. But the trade-off is that their knees are feeling better after they've rested, so they think that they're healing it. The problem is that cartilage, ligaments, all these other tissues inside the knee joints and that control the knee need some activity. Really, if you're off your feet for a while, you begin to lose important muscle that can help to stabilize and control your knee as it gets better. The cartilage and ligaments themselves are influenced by how much pressure you put through them. So the proper way to go through this so that you can make sure it gets better as fast as possible is by doing what I call relative rest, meaning you still get up and move around, you still have to take care of your house, you still have to go to the bathroom, go eat food, go to your kitchen or go out to grab food. And I want you to do those things, but plan on getting off your feet as soon as you're hitting your tolerance level. What I mean by that is once you've been up on your feet for 10, 20 minutes or more, whenever your knees kind of start to hurt you a bit, that's when it's time where you should plan on sitting down and taking 5, 10 minutes or more, whatever it needs for your knees to calm down before you resume activity. So find that threshold for yourself. If you're with family, if you have kids or grandkids, find out where you can sit, plan, tell them that you're going to have to take a break every now and then. And if you spend a few days, maybe even a couple of weeks doing that, you can usually get a good handle on your knee problem so that you're not having to take a forced break all the time and having to take pain medications and injections and seeing the doctor sooner than you planned on seeing him. Treatment number 2, using a brace. Many of our clients come in using a brace already. I see people doing this all the time. And I always have to ask them, how did you get this brace? Did you go buy it on your own? Did you already have it from another knee injury? Did you get it from a friend? Or was it given to you by a medical professional? And the reason why is because the advice that comes with the brace, either what they found on the internet, what was on the box where they bought the brace from, or whatever they were told by a medical professional or friend. People rarely ever understand that knee braces are only temporary. They should not be used for the long term. Knee braces won't fix a knee problem for the long term. There's a few circumstances where a knee brace is needed a little bit longer than others, especially with a ligament problem like an ACL injury, MCL, LCL, PCL injury. All those are ligaments in the knee. But with other types of injuries in the knee, they're not 100% needed unless you've had surgery. They're not 100% needed. Now they can benefit by giving you some perceived stability, which will allow you to be up on your feet a bit longer. There's a few rare circumstances where having a really tight bracketed knee brace will benefit. But in the long term, knee braces are not good because they teach the muscles around the knee to not work the same, and that's not good for a knee joint. So there needs to be some plan in place to eventually get off the knee brace so that the knee can get all the way better without having to rely on it for the long term. And most people like that news because wearing a knee brace is not comfortable always. They get sweaty, they get smelly, especially in the summer months, and it's not fashionable if you're trying to wear shorts or a skirt or dress or something. So having a good plan to get off the knee brace is going to be the best thing for you. But in the short term, slap that knee brace on and see if you can get by without taking pain medications or having to go visit your doctor as fast as you thought you might. At-home treatment number 3, exercise. Now, there's all kinds of knee exercises out there and exercises for the foot and hip and back too, which greatly influence the knee. Having a specific exercise plan is a very beneficial thing for when your knee hurts. Now, I always have to ask the question is, what happened? And if you had an accident, if you fell or somebody fell into your knee, then it's obvious how your knee got hurt. But if you didn't have an accident, a specific recent accident when the knee pain flared up, then there's something wrong with the way your muscles are pulling on your knee, some cartilage issue, the way that you're moving. There's some issue that you obviously aren't aware of at this point, otherwise you'd fix it, that is feeding into the knee problem. And discovering that issue may take some expert help. Somebody like a specialist physical therapist may be able to help you out with that. There's also lots of exercises on the internet. You've got to find out what kind of problem you've got and which exercises will benefit your knee the most. Now, a quick rule of thumb is if you do an exercise that's supposed to help your knee problem and your knee feels worse right away or right after the exercise, it is not a good thing. And not even the "it hurts so good" sensation. Avoid that. About 9 times out of 10, exercises that work out the quad muscles, the muscles that are right above the knee on the front of the thigh, are going to be harmful for a knee problem. And it's kind of counterintuitive. You would think that those muscles need to be strengthened, and sometimes they're kind of shut down or not working right. And it doesn't mean that they need to be strengthened. They need to be more so coordinated, which is a different process than strengthening. But you got to be careful with which knee exercises you choose. Now, a quick shameless plug. We've got a program called the 28-Day Knee Health and Wellness Boost Program that is specifically designed to boost knee health and wellness. If that's something that you're interested in, hit the link in the description and you'll get more information on it. Now, back to the exercises. Pay attention to how your knee's behaving if you're doing some knee exercises. And if you're just having trouble with it, get to an expert, get some specialist help so that you don't make your knee problem worse and you don't keep it there longer than it needs to be. Otherwise, you can end up with some serious problems if too much time goes by. Treatment number 4, stretches. Now, stretches generally are pretty safe for the knee and they can provide some quick short-term relief. There's a simple one like bringing your foot to your bottom and stretching out the front of your thigh. There's one where you reach your foot. There's all kinds of stretches out there. It won't be hard if you Google types of stretches. You generally want to stretch what feels tight. Where I want to caution you on this, how you stretch matters. And depending on what video you find or what information you find online about stretches or friends or family or even healthcare professionals that tell you to stretch, here's some guidance that I would apply to it all. Don't stretch too hard. On a scale of 0 to 10, 0 meaning you feel nothing at all, and 10 meaning you're about to tear whatever it is you're stretching, I would hang out no more than a 3. And the reason for that, this is going to get a little scientific. There's little cells inside our tendons and muscles. Tendons and muscles are what you stretch whenever you get a stretch sensation. When you overstretch those little cells, they have their nerve endings that connect to your brain and the muscle. They create something called the stretch reflex. You can Google this. The stretch reflex is a protective mechanism built into tendons and muscles that is designed to protect the muscle and tendon from getting overstretched or tearing. And so what happens is if you stretch beyond a certain amount, that muscle starts to contract in order to protect itself and the tendon, and it won't let you get that good of a stretch. So you're better off doing a light or a mild stretch and holding it for a longer period of time. Usually 30 seconds to a minute or more is plenty. More than a couple of minutes is you get diminishing returns. In other words, it's not that much more beneficial. But doing that kind of stretch is truly the best way to stretch. Now, if you try that out and you're like, that's too light, it feels like nothing, and you're looking for that intense stretch, that intensity that you feel during the stretch might actually be you get the stretch reflex going, the muscle contracts, and you might actually be stretching out your tendons. If you feel a big, huge, enormous stretch and it feels through the entire length of the muscle, especially at the ends of the muscle where the tendon is, you might actually be stretching out your tendons, which is bad. Tendons can't really shorten very easily. They're not muscle. Muscles can contract and lengthen, but tendons just remain the same length. So if you accidentally overstretch your tendons, you're creating a worse problem, very, very likely. So watch out with stretching. Don't do it too intensely. Treatment number 5, supplements and dietary changes. Anti-inflammatory foods and anti-inflammatory supplements are a real thing. If your diet's not the greatest or you haven't really ever explored taking supplements, I highly suggest you do some research and find out what might work for you. Now, in my experience, and I'm not a nutritionist or a physician, I'm a physical therapist, so this isn't my specialty at all. I'm going to just put that out front. What I've seen from patients is there's different body types, different genetics that everybody has that respond to different supplements and diets. And some people can try the anti-inflammatory supplements and diets and have a really good outcome. Their joints feel better, their knees feel better, their knees tend to stop hurting. Now, there's still some mechanical problems that I help them with that allow them to avoid having a worse problem later on down the road. But in the short term, they can get control over their knee problem without taking pain medications or having to rely on injections, and worse yet, avoiding a surgery. But there are some people out there genetically that just don't respond to dietary and supplement changes. So they'll tell me, I tried this diet and I tried this supplement and my doctor even told me to take this and it had zero effect. So, I can't speak to why that is exactly or what's better or worse as far as supplements or diets. It's not my specialty. But what I will encourage you to do is to research and learn, because maybe there's a good chance that there's something simple that you can do throughout your day as far as taking a supplement or changing the way you eat slightly that can make a huge difference on your short-term knee problem. So those are the 5 treatments that you can do at home for when knees hurt. Well, I hope that this video was helpful for you. If you enjoyed it, please give us a like and hit the subscribe button over here so that you can get notified whenever we release new videos. Thanks so much for watching, friends. Bye-bye.